and this foreign body is iron doing pakaram pakaram pakaram. So what do you expect? I expected after he started seeing that IUD, I'll be walking as if, you know, as if there's something in between me. Won't this thing fall off, or won't I feel like, won't it be choking me? Okay, if implants would not be okay, that I would prefer the pills, I would prefer the injection, as far as it's not IUD. Because I have had a lumpectomy, that I cannot go for anything hormonal. While the nurse was prepping all the instruments, I was just hearing like oh my god, my head was like, oh my god, is this what these people are going to insert in me? I was checking my cervix to know if I have any inflammation or if everywhere is set and healthy for this. She was like, that this your cervix is very tight though. Are you sure we are going to do this? Oh my god, I was like, hello everyone and welcome back to my YouTube channel. It's Diamond Mom here. If you're new here, hi and welcome. Please do also subscribe to this channel. To my returning subscribers, thank you guys for always coming back. So in today's video, I'll be sharing with you guys my IUD experience. I've had my IUD inserted for like more than 3 months and some weeks, and this was after my C-section delivery. So I'll be sharing with you guys my experience, the procedure, the factors that determined my decision of going for an IUD, the effects it has in my body, and just everything in general. So I went for this procedure on the 6th of September, just a day after my baby clocked 6 months. Now I would have gone for this IUD insertion since, but I had to wait till 6 months due to some indecision on my part and fear, because I have 2 babies right now and I'm not ready to have another so soon. And not yet. So immediately after my birth, I heard during the immunization that you should come for your family planning procedure 6 weeks after. So when I clocked 6 weeks postpartum, I went to the hospital, and then already I had in mind a procedure I wanted. Now this is one mistake that you shouldn't do, please. There are some factors that would determine the type of family planning that will be given to you. So you don't just walk up and then go to the hospital and tell them to do this for you. So you need to ask. You need to tell them, they'll ask you some questions and then they will make the choice for you depending on what is good for your body. So I went to the hospital with the mindset of okay, because I had read up on how the IUD is being done and the implants, and I was like, no, because being that I'm not really comfortable with anything going down there, be it hand or any instrument, so I felt like okay, an implant would be very okay for me since it's just underneath the arm, so it would be okay. I don't want any discomfort down there and all those stuff. And then I've heard stories of how some people's IUD would fall off and then the child would come out holding the IUD in his hands, and so I was just not ready for any mistake and all those discomforts, those pains. So I went to the hospital 6 weeks after my C-section delivery, and I told the nurse, I went to the family planning section, and I told the nurse that okay, I would like to do this family planning, the implant. So she was like okay, she asked me my age, checked my weight, checked my BP, and fine, I was fit for it. I thank God that we didn't really rush this procedure, because she had already told me to go and make the payments. On my way going to make the payment, she had to rush down and call me back that no, that there is a problem. Now it seems while I was on my way going to make the payment, she now went through my folder, because of course that is the hospital where I give birth to all my children. So she went through my folder and then she saw that I had once done a lumpectomy. Now if you don't know what a lumpectomy is, it is the surgical removal of lumps in the breast, be it abscess or lumps or any stuff in the breast. I had this lumpectomy for like 6 years ago. So of course during my pregnancy, during my first antenatal registration, you'll be asked if you've had any surgery. So I indicated it and it's already there in my folder. So while going through this, she saw it and then she told me that no, that because of this surgical operation I've had, that I cannot do anything that has to do with hormone, because of course the implant, which they call Jadel, has to do with the hormone. Also pills, injections, because I was like okay, if implants would not be okay, that I would prefer the pills, I would prefer the injection, as far as it's not IUD, because I wasn't ready for an IUD. So she told me that see, because I have had a lumpectomy, that I cannot go for anything hormonal, so that I don't trigger up more lumps growing in my breast. So I was like wow. I was grateful on one part, of course it's for my health, but I was unhappy because oh my god, so I'm left with the only option of IUD, and that is where everything started. Like I had to, because okay, I was like okay, so what is required, so what do you expect of me? So she said that because I just had a C-section delivery, that I have to go and wait for 3 months, guys. So if you just had a CS and you want to go for an IUD, please, you need to wait for 3 months so that your scar would heal very well, because of course the IUD is going to be inserted in your womb, so you don't want anything that would cause any rupture or any kind of mess in your body. So I was asked to go back and come back after 3 months. And then so I went back. I was actually happy that okay, thank God that it will not be done immediately, because of course I wasn't mentally prepared for all those stuff. So I now had to go back home. See guys, the indecision, I will go when my baby clock 3 months. That was when I got to 3 months postpartum. I started to delay. Okay, I will go this week, I will go next week, I will go this. While on this, like, I was always praying because of course I was on exclusive breastfeeding. And from my first baby, I know that when I'm breastfeeding, it's usually like a natural family planning for me. So I know, okay, I will not get pregnant, but I was also scared. So I had to linger on because of this fear of, inserting whatnot into my private parts and all those stress, all those pains. But finally, I just decided that, see, would you not rather bear this pain for a maximum of highest 10 minutes than for you to go through another 9 months, and then you have to go through another C-section, and you have to start nursing the child? See, it's a whole lot. So I just decided to make up my mind, and on the 6th of September, I went for this procedure. Now, on getting there, everything was already set, the payments, everything. There is a chart, a pictorial chart in the room where the procedure will be done. So while the nurse was prepping all the instruments, I was just hearing like, oh my god, my head was like, oh my god, is this what these people are going to insert in me? So I was going through that pictorial chart and seeing the way, like, everything, the woman would squat, the woman would do this, the woman would, oh my god, I was like, geez, I was in fear. Like, I was just trying to, to be mentally strong, but I knew that I wasn't strong for this. So I had to lie down. So when she was done, she told me to, remove all my undies, and then I lay down on the bed, and she had to use this, the antiseptic, the one that is good for the body, and then she used her hand, because she wore a glove, she used her hand to check how my cervix is. And guys, before going for when you go for your family planning, you would be asked to do a pregnancy test. Yes, I omitted that because I ran a pregnancy test. But then they will ask you, how long have you, when last did you meet? If you just met with your husband yesterday or the day before yesterday, you'll be sent back to go and come back in 2 weeks. And within these 2 weeks, you either use a condom or you don't meet with your husband. So I had just finished my menstruation, because I was told to come after my menstruation. So I had just finished my menstruation for like 1 week ago, and I didn't know that I was supposed to go like on the last day of my menstruation or the next day, because at that time your cervix is still open, and being that I have not had a vaginal delivery at all, my cervix is still very much tight. And guys, I had not met with my husband for like going to 2 weeks, because I just had my menses, and after my menses I stayed away, just to be sure that, okay, there is no emergency pregnancy that will disturb this family planning. So as she was checking my cervix to know if I have any inflammation or if everywhere is set and healthy for this, she was like, that this your cervix is very tight too. Are you sure we are going to do this? Oh my god, I was like, Jesus, what am I into? Like, what am I in for now? So after that, after checking everything, and then she saw that, okay, that the environment is very safe for this implant. Now I did the copper IUD, because of course I cannot do any hormonal family planning, so I was given the copper IUD. So after checking everything, then she now brought out the speculum. I don't know, I'll insert the picture somewhere here, the speculum. And then that thing is something like, oh my god, like, I was so scared, because I already seen it in the pictorial chart. I was so scared when she brought out the speculum, and then the only thing that was in my mind was, I was just like, oh my god, I was just like I was just singing different songs. In fact, that day, I became a composer. The songs that I didn't know existed, Jesus, you are here, Jesus, my savior. Like, I'm just trying to, to use that song to remove whatever fear, to take my mind off from the pain and the discomfort that I was feeling. See, I'm just naturally scared. I'm just naturally scared, because I would say the pain is not up to what I estimated. Okay, so when she brought out the speculum, she tried pushing it. Now remember that my cervix is very tight, so of course it would be much difficult than someone who has had like a vaginal delivery. So my cervix is still very tight, so pushing the speculum and everything, I was actually feeling it. I was feeling, but I was not feeling any pain. Now there's a difference between pain and discomfort. I wasn't feeling any pain, but of course now, typical me, I would be like, as if it's paining me, but to be honest, it wasn't painful. I was just feeling discomfort, because of course a foreign body entering into your private parts. I felt a level of discomfort, so she pushed the speculum inside, and then she set it open, because I feel like that speculum is to be able to see the inner wall of your vagina, and to be able to reach, your cervix and your uterus. So she inserted the speculum, and then she opened it, and that was when she now brought one thing, all those pakaram. So she was doing everything, doing. At this point, I wasn't feeling any pain. I wasn't feeling any pain, to be honest. Just discomfort of, okay, things are going on inside of me. Then when she brought the IUD, copper IUD, she inserted it, and then it seems it was when she puts it like into the womb, when it fell in place, when it was placed properly, that I felt a sharp pain. Now this pain just lasted for like 5 seconds max. I just felt a sharp pain in my womb area, which I don't know if it's because of my C-section scar. So, but I don't know. So after that, I just felt like a little discomfort that okay, something is, something is going on in my lower abdomen part. So I just felt that discomfort, and that was the only pain I felt, guys. I would say that this procedure is not that painful, but you would feel discomfort because of course if a foreign body is going into your vagina, of course you're meant to feel, and this foreign body is iron doing pakaram pakaram pakaram. So what do you expect? So after that, now so after putting the IUD, she removed the instrument and also removed the speculum, and she told me to calm down. I was like, immediately, because I expected after inserting that IUD I'll be walking as if as if there's something in between me. But guys, when she told me to calm down, I was skeptical. Are you sure? Won't this thing fall off, or won't I feel like, won't it be choking me? So as I came down, I tried to feel, oh my god, I didn't feel anything, seriously. So she told me to squat. She now taught me how I will be checking it, because you're meant to be checking it every week to know if it is in place. So she told me to bend down. So I squatted there after disinfecting my hands. Then she told me to use my left hand, the longest finger, to insert it into my vagina. See, I must be honest. This is the first time I'm having to do this. See, I'm not one to be to be going where no concern me, like wetin I dey find there, like I don't know wetin I dey find there. So I was scared, but typical Nigerian nurses, they don't have time for your smell. So I just had to summon up courage and then use my hand. She told me put it inside very well. So as I put it inside, she asked me if I could feel something. So I felt the copper wire, the cord, something like a fishing line. So I felt it, and then she asked me to use my hand and push it inside. So I had to push it inside very well. And then she told me that okay, that as from now, every week, that after taking my bath, while that side is still wet, that I should make sure I wash my hand very well. And I will do this, and I would check that if I see the rope, it means that the copper IUD is still in place. But what I would do is to just push it in so that it doesn't start shaking me, so that it doesn't come out too much. So what I will do every week, I will be pushing it inside. And that, but if I'm very much active with my sexual life, that I won't need to be doing that, I won't need to be pushing it inside, because of course during sex your partner's organ would push it inside for you. So that is basically how the experience went. It wasn't that painful. I just felt discomfort, and normal me now, I took the fear. So, and my song actually helped me. So guys, after that, I was told that I would be coming for checkup 6 weeks, 6 weeks, 3 months, 6 months, 1 year, then and this copper IUD that has been given to me is for 8 years. So I was like, okay, it's for 8 years, it will be active for 8 years, after which if I want to continue, I'll come, they remove it, and then they put another one. So guys, I went home, I asked the nurse, she said that okay, I might feel maybe cramps, I might feel pains, I might see blood, spots, that my menstruation might also flow heavily, that for some people that their menstruation even reduced, for some people their menstruation cease, while for some it flows heavily, like it flows for more than your normal day. If you used to see your menstruation for 4 days before, now you might start seeing it for like 6, 7, 8 days. So when I went home, I was like actually conscious of the signs, but guys, I didn't feel any pain, I didn't feel any discomfort, and I did not also spot, to be honest, because even when I'm pregnant, I do hear people saying that that they used to see blood when they are pregnant, but for my 2 pregnancies, I've never spotted, I've never had any blood, any discharge, like any bloody discharge. For the pain aspect, of course, your mind is messing with your body, so I was feeling discomfort, but there's no pain. I did not feel any pain. I would try to bend and see if anything would choke me and all those things, but nothing was choking me. And also when I met with my partner, I asked if he could feel anything, so he said no, that he didn't feel anything, because there's some people that say that during their sexual activity with their partner, that their partner used to feel the rope, but mine said he didn't feel anything. So apart from that, guys, there's basically nothing, like, and my menstruation still comes out normal, because before my first pregnancy, before I got pregnant, my menstruation used to run for 4 days normal on a regular 27 or 28 days cycle. So it usually runs for 4 days and normal blood flow. But after my second baby, in fact after my first baby, I noticed that my menstruation started to flow heavily. Even after my second delivery, my menstruation still flows heavily. So even after this IUD, I still have my normal heavy flow, which I would not attribute it to the IUD. So it's just after pregnancy, body change and all those stuff. So there's basically nothing. And I've gone for my 6 weeks appointment. You would expect that if you're fear like me would not go for an appointment at the see. The fear of another 9 months pregnancy is the beginning of wisdom. So I just couldn't risk this thing slipping off, or then why didn't you come? If you had come earlier, I would have noticed it. So I just had to go for my appointment, even though I was expecting okay, they would still do all those stuff, but I was ready for it, to face it once and for all, than to go through another 9 months. So when I got there that day, it was another nurse that was there. So she asked me to lie down. I was like, again? So she asked me to take off my undies, and I laid down, and then she brought out that speculum. See, whenever I see that speculum, I see it as an enemy, that huge instrument, going into you, and So she brought out the speculum again and she inserted the speculum. So but guys, before I could say jack, she was done, like literally in less than 30 seconds. I'm not kidding, in less than 30 seconds she was done with the check. And I was like, wow, is that all? So she brought it out, and then so I guess maybe what they do at that check, at the 6 weeks, 3 months, and all those stuff check, is to just open it with the speculum and see if it is still in place. So when she put the speculum, she just opened it and then she saw it and said, okay, I should come down that it is in place. I was like, okay, like okay, thank God. But guys, even before she put that speculum, I was scared. I was still shifting. But then I went, my 3 months appointment was due last week Tuesday. So I went, and guys, this time I went, I was a jagaban, like, I'm now an oldie. So I went, I lay down because I already knew what to expect. So I lay down, and the lady was, the nurse was just doing what she was doing. So within 30 seconds she was done, she brought it out. She told me that okay, everything is well. In fact, she was even hailing me that I'm really trying, that I'm a serious person, for me to have come for my 6 weeks, my 3 months, that some women, they would not come. And then I would just advise you to try and take your appointment seriously, because to avoid anything, there are some women that this thing might actually separate in their body, and they don't know, they'll be going with this dangerous thing. It is a foreign body, so it should not be in the wrong place, and it should not be disconnected. When the vertical one disconnects with the horizontal one, it will not be nice, it's being in your body. So I would just advise you to take your appointment seriously. It's not painful, the appointment is not painful, in less than 30 seconds you are done, and you will have that peace of mind. So right now, my next appointment is due in May next year, that is 6 months exactly, and I wouldn't miss it for anything. So after this, it will be due in 1 year, like yearly checkup. So guys, I would not say I regret it. In fact, this is the best decision, this is the best family planning decision that I made, because of course I know that okay, it's not tampering with my hormones. I don't feel any mood swings, apart from our normal typical women mood swings now. I don't feel any mood swings, any pain or anything. In fact, I even forget that I have this thing. And to be honest, I've not been checking, the weekly checks and all those. I've not been doing it. I've not had any infection, I've not had any, like, nothing. I'm just perfect and I'm just fine. And I would advise that please, whenever you go for your family planning, you should not be upfront as to telling the nurse that she should do this for you, she should do that for you. Please just listen to what they have, because they would advise you on the best one for you based on your body, your history, and all those things. So guys, I just thought to come here and share my IUD experience, because I've been seeing so many people being scared about this thing IUD, that it would affect them, it will affect. So I feel like if you go for the copper IUD one, and if it is good for you as advised by your nurse or by your doctor, that you would not have any side effects. So guys, I hope you found this video informative and educative. If you did, please give this video a thumbs up, and also subscribe to this channel. Also leave your comments in the comment section if you've had your IUD, for how long, because I'm just 3 months into the game. So if you've had this IUD, for how long, what are your experiences, what are the side effects, do you have any regrets, and what would you advise anyone who wants to go for this IUD? So guys, thank you for watching, and I'll see you in the next one. Bye for now.